Another thing we're testing for is rubella. We want to know if you are immune to rubella or not. This is the childhood disease that is vaccinated for in the MMR, measles, mumps, rubella. Because if you contract rubella during pregnancy, it can cause birth defects. We want to know. Now, you can't get this vaccination when you're pregnant because it is a live vaccine. And so it is not given, you would have to wait till after your pregnancy. Now, luckily in the United States and Canada, rubella is quite rare, but just in case, okay? The next one is an RPR. Now the RPR tests for many things, but what we're looking for specifically with the RPR is syphilis. We want to know, do you have syphilis floating in your blood? Because that can be very bad for pregnancy, for baby. And it's just not good for you either. So we can get you treated for that before the pregnancy proceeds. And then the last one that comes in the typical OB panel is HIV. We want to know if you have HIV. Now, urine testing, many practices also include a urine catch. It's called a dirty catch. It's called a dirty catch because you're not cleaning the labia and the urethral opening before you give the sample like you would if you were testing for a bladder infection, okay? They're going to have you pee in a cup without cleaning, and this tests for group B strep, which can cause a lot of bladder infections during pregnancy and is also dangerous for baby during labor. They can catch it. And then they're going to look for chlamydia and gonorrhea so that you can be treated early for those. Because once again, they can cause issues with pregnancy, with the placenta, birth defects, many issues that way. Now, there are some additional tests that we run in our practice. One of those is vitamin D. Every single person that we have ever tested that does not supplement with vitamin D, or they supplement with very low doses like 400 units, they test in the teens and the 20s. Across the board, I've never seen an exception for this. I'm sure there's an exception, we just haven't found it yet. And vitamin D is vital in your moods, in fighting depression. It also helps with your immune system, and it doesn't pass through breast milk until your levels reach 80. So your pediatrician will say, oh, babies don't get vitamin D through breast milk. And most of the time, almost all the time, they're right, because nobody's levels are at 80 without supplementation. So in our practice, we test for this because it takes about 10,000 units a day for 6 months for us to even get close to having our moms be near the 80 line. And we want them above that so that it will pass through their breast milk. The next thing is ferritin. We are going to test their ferritin. Even if their hematocrit and hemoglobin came up just fine, we are still testing for their ferritin, because some people who are not anemic, but they have very low ferritin, which is low iron stores. So they can become exhausted, fatigued. Really not great things happen when you're low in ferritin. So we want to test your ferritin extra. The next thing we're going to run is thyroid. We are going to run not just a TSH. Many providers only run a TSH with reflex to free T4. And you may not know what that means. What it means is if your thyroid or if your TSH comes back in an abnormal range, then they will test for the free T4. And they never test for the free T3. Okay, why is this important? That's what we're taught in medical school. That's what we're taught in nurse practitioner school. But that's not what is correct. We need to test the TSH, but you can have a normal TSH and your free T4 can be low or high. In pregnancy, we do not want a low free T4. Why? Here you go. Free T4, our bodies take it and we convert it into free T3 or into T3. Free just means it's what's floating around in the blood. We take T4 and we convert it to T3. T4 can cross the placenta. T3 cannot. And the baby has to make their own T3 from the T4 that we give them. If we do not have enough T4, because baby doesn't make their own, so if we don't have enough T4, we can't share it with baby, and baby can't make their own T3. And this can cause problems with development, the placenta, brain development, so many issues in pregnancy. I also want to know what your levels are. They need to be in the top 25% of what is considered normal. Definitely need to be in the top half. Let's use imaginary numbers here because every lab is a little different and values from country to country is different. Let's say that normal for T4 is 6 to 10. Many providers, if your levels come back at 6.2, they'll say, oh, they're fine. They're within normal range. Or they're at 7. Oh, they're fine. They're within normal range. This is not the case, especially if you are symptomatic. You want it in the top 25%. So the minimum we want it is an 8, but we'd prefer it to be a 9. Like I said, ignore lab values from what your doctor has because I'm giving you an example of lab values depending on your lab. If between 6 and 10 is normal and your doctor tells you you're fine at 6.5, give them research. You are not fine. Your free T4, not your T4, your free T4. The thyroid that is floating and available in your blood for your body to utilize needs to be in the top 25% and at minimum in the top 50%, or you won't have enough to share with baby. This is very important. We test the TSH, the free T3, the free T4, and sometimes we'll even do a TPO, which is antibodies in the thyroid as well. The next thing we test for is a hemoglobin A1C, and that is the average of your blood sugar levels from the past 3 months. We want to look at your blood sugar levels to see where they are. Now in Canada, it's different from the US because they use a different measuring system. So I'm going to give you the US measuring system here. Someone who is relatively healthy, we find their levels are typically around 5.1, 5.4. They might be as low as 4.8. That is pretty good. We don't see that very often in the 4s. What we don't want is it to be in the 6s. Now, at 5.7, 5.8, you're pre-diabetic. But once you reach about 6.4, you are type 2 diabetic. We are going to do the glucose tolerance test later in pregnancy. But I want to know if you have undiagnosed type 2 diabetes way before we get to 24 to 28 weeks. And so I'm going to be testing your hemoglobin A1C to make sure that we don't need to deal with diabetes now in the first trimester rather than when you are 2/3 done with your pregnancy, because that can cause preterm labor and some pretty serious issues for you and your baby. If we can catch those issues early, we can help you with diet changes and we can get you on insulin in this pregnancy so that you have a safe pregnancy. Now, a few supplements that we have women do when they're pregnant, according to this blood work and because of different labs that are run, are vitamin D supplementation. And most prenatals do not have enough vitamin D3 to help with supplementation. With vitamin D, to help it absorb better, K2 and vitamin A are a great combination. We use a product called ADK by BioT. There are some really good ones out there, but if you can get D3 and K2 together, that is fantastic. If your prenatal does not have sufficient vitamin D3, you'll need to add it. And I will tell you, I've never seen a prenatal have as much as they should. The highest I've ever seen is 5,000 units. And when you're hanging out in the teens or the 20s, you need more than that. We have all of our moms supplement with vitamin D3 and K2. The next thing we have them supplement with is a probiotic. Even if their prenatal has probiotic, we want them taking a separate probiotic. There are a couple that we like from Olin Supplements. It is a great one. It was a dad who created it because his child had cancer and chemotherapy destroys the gut, that good bacteria. His child couldn't swallow pills, so he created what looks like a pixie straw. It does not have artificial sweeteners, artificial dyes. It is a pretty good one. And just find a really good one out there. There are some really positive, but we do find it has to be separate. Now, why are we doing this? One, most of our guts are pretty much destroyed in today's world, but Group B strep. Group B strep comes from the intestines, and when it is overcolonized, it moves up past the perineum into the vagina and can affect baby. It can cause bladder infections in you, which is why we've tested for it at the beginning of pregnancy in your urine. And then we test for it again with a swab that we culture at 36 weeks. And I am finding that most women, that almost all women actually, that do not take a probiotic are testing positive. It's great if you do kombucha, non-alcoholic, of course. Great if you do sauerkraut. Great if you eat yogurt. I am finding if you don't supplement, my mamas are testing positive. It has to be a separate supplement on top of your diet, on top of your prenatal for it to be effective. We do not want to have Group B strep. That is tested for at 36 weeks. Let's do a quick recap. We have the OB panel. We test for thyroid, TSH, free T3, free T4, possibly a TPO. We test ferritin, hemoglobin, A1C. And then at 24 to 28 weeks, you'll get the glucose tolerance test, the GTT it's called. And then at 36 weeks, we are going to get the GBS test. Now, sometimes at your 28-week test, or if you've been anemic, they will do additional blood work. They'll rerun the CBC or a ferritin, and they'll get those things taken care of for you, making sure that your supplements are actually working. Okay, get those taken care of. If you have thyroid problems and you are on medication, your thyroid must be tested every trimester. Think of it this way. This is a really easy way. 10 weeks, 20 weeks, and 30 weeks, your thyroid needs to be tested to make sure that your medication does not need to be adjusted. This is really important for you to do. You'll need to be tested again postpartum after 6 weeks to make sure that your medication doesn't need adjusted again, because pregnancy does cause the thyroid to fluctuate. Now you know a little bit more about the blood work and different lab tests that are run in pregnancy. I hope that this answered some questions for you, and I hope that you are able to talk to your provider about it and get the additional testing if necessary so that you can have the healthiest pregnancy possible.